We're here in Kisumu, Kenya, where a lot of HIV-related clinical trials take place. Many of these trials focus on HIV prevention, as researchers look for alternatives to the male condom. Male circumcision is one of these alternatives. Circumcision trials conducted in Uganda, South Africa, and here in Kenya all demonstrated very similar results.
We've conducted a clinical trial here in Kisumu to try to see if there's a difference between circumcised and uncircumcised men in HIV infections. And so we recruited 2,800 young men, and they were randomly assigned to be circumcised or to remain uncircumcised for 24 months. And at the end of the 24 months, we found that those in the circumcision group had 60% fewer HIV infections than those in the control group.
The question of what to do with that evidence is being debated around the world. In Kenya and elsewhere, many consider the implications of rolling out circumcision as part of national health policies. While the World Health Organization and UNAIDS made recommendations in favor of adult male circumcision, women working at various AIDS groups were apprehensive about scaling up circumcision as a prevention method and said that condom use was increasing slowly but surely.
Although, yes, the male circumcision is good, but it cannot be a preventive. We can't put it as a priority, as a number one in prevention of HIV and AIDS, because these men are going to feel like, now that I'm circumcised, man, then I'm safe and I'm going to just have unprotected sex. And there'll be so much ignorance. So with that, I feel like, well, we can tell them it's good to be circumcised, but that is not a preventive measure. They still need to have protected sex.
Women are twice as vulnerable than men to HIV infection. So critics say, while circumcision could help reduce men's rate of infection, the slightest decrease in condom use could actually increase women's rate of infection.
I think biologically it's been proven that male circumcision at least works when the outer skin of the male is removed. That's okay biologically, but I don't think it should be used as a tool just to say, okay, it's fine, it's a preventive measure, and no, because we stand to lose a lot of what we've already gained in the fight against HIV and AIDS, and especially in Africa, looking at the issues of who has more power in terms of sex within our communities. Then we feel that then, men will still have more power, and the vulnerability of women will worsen.
Well, I mean, it's going to be a major challenge. Is first, why should I get circumcised if we know that using condoms is effective? And there is the issue that, circumcision isn't going to change any of our prevention messages. Circumcised men still have to practice safe sex. They still should use condoms consistently. They should be faithful to one partner. They should get tested. All the same prevention messages that we're using now are going to be applicable even to circumcised men. But the other way to think about it is, at the population level, I think there's little doubt that circumcision is going to have a significant impact on the epidemic at the population level in high HIV prevalence areas where circumcision isn't traditionally practiced. So if we can get large proportions of men circumcised, if we can get them to agree to that and provide the services safely, I think there's little doubt it's going to have an impact at the population level.
While the debate continues, plans on how to implement circumcision have already begun. This is Harriet Hirschhorn in Kisumu.